Hi, my name is Daniel Jiang. I'm practicing OB/GYN at the Reading Hospital at Pennsylvania, and also a professor of obstetrics and gynecology at the Drexel University College of Medicine. So, as we all know, and autoimmune disease are far more prevalent in women than men. And according to the literature, the woman actually has an average 4 to 5-fold higher risk of developing autoimmune disease and compared to men. So, and also menopause transition increases risk of developing autoimmune disease later in women's life. So, and hormone therapy was used to alleviate menopausal symptoms, and we're thinking, adding estrogen back through the hormone therapy may potentially reduce the incidence of autoimmune disease later in life. So that's why this thought process prompted us to do this study and try to find out if hormone therapy has any beneficial effect in terms of reduction of autoimmune disease incidence of autoimmune disease. Our findings is kind of surprising. Actually, it's opposite to what we are expecting. So, our finding suggests that hormone therapy actually increases risk of developing autoimmune disease in postmenopausal women compared to the counterpart group. So, still the underlying mechanism largely unknown, so it still require more research. But and this finding definitely require clinician to take precaution and take individualized approach. So when we're prescribing hormone therapy. Yeah, that's a great question. So, I think at this point, and it's too premature to draw any conclusion, and too early to say hormone therapy is contraindicated in the women with autoimmune disease, either family histories or personal histories, because we really require more prospective study to look into this. At this point, I would say, just require clinical vigilance. And if a patient had personal history of autoimmune disease, or maybe family histories, then clinician probably need to discuss with patient, require shared decision making, and also educate patients regarding the symptoms of autoimmune disease, and also close monitor the symptoms, of like a newly onset autoimmune disease when they are on hormone therapy. But I would not say this women is contraindicated for hormone therapy. Yeah, this is another great question. Definitely we need more studies and look into the different of dosage, and also look at a different regimen, like estrogen alone versus estrogen plus progestins, and also look at the time of initiation of hormone therapy. Want to see if a timing hypothesis also apply to this subject, and also want to look at just autoimmune disease population to see if this problem need a retrospective data to look at the autoimmune disease, women with autoimmune disease who were on hormone therapy, to see if this population has a worsening autoimmune disease symptoms, or maybe just exaggerating the severity of the disease. So also look at any newly onset of other autoimmune disease as well. So it's many study, required to look into this. And we all know WHI study, initial findings come out around 2002, and that study caused, hormone therapy phobia, right, in public. Everybody just so scared of putting hormone therapy on their patients. But later on, when we look at the data, differently, this stratifying data based on age, right? So then we realize, timing hypothesis actually is true in this population. If you initiate hormone therapy in early age, early menopausal women, and actually it's benefit greater than risk in that population. Probably same thing for autoimmune disease. So that's why it requires more study to look into this. As definitely it's too premature to say anything like yes or no answer. It's no yes or no answer. It's not set in stone.